In Sydney, one of the Shen twins, Audrey, is with Tonkinese cat Misha, who is in a lot of pain with a badly swollen face.
Hi, Priscilla. How are you?
Hey, Hershey.
Thanks for getting Misha in the carrier for me.
You're welcome.
Owner Priscilla is hoping Audrey can find out what's wrong with her much-loved 9-year-old.
Her face. Poor thing. I can see it quite swollen there.
Yes. She says yes.
Yeah, she says yes.
Misha's face got really swollen and obviously something was quite wrong and she was not feeling herself. She was like, didn't want to have cuddles and wanted to be left alone. And so we got really worried and we called the vet.
Well, what we'll do is I'll take her into a van, have a good look at her, and then we'll go from there, whether we take her into hospital for more investigation as well.
Okay, sure.
You're worried?
Yeah, I'm sorry.
No, it's okay.
She's my kitty cat.
I know,
special
she's your
girl.
baby girl.
Yeah, I know. Come on, kitty, be okay, right? Hi, Misha. Let's get inside.
Big step up.
We're hoping to find out what's going on with poor Misha. It breaks my heart to see my cat like this. Yeah.
So it's nice and warm.
Yes.
Here we go.
There you go.
Oh, it looks so swollen. So even just you can see how much swelling there is just underneath the eye, just going to the top jaw. Certainly I'm thinking infection at this stage and just that pus is accumulating under the cheek there. Her back molar at the top is quite red at the root, and there's a bit of pus dripping out behind the tooth. But once that completely heals, we do need to talk about diet and try to prevent her having any further dental disease in the future. We don't want this happening again. I am worried. I can see that back tooth is very infected, and what that probably means is her jawbone is also very infected. So I think with the condition that I'm seeing here, time is of the essence. That abscess is very painful and it's actually getting bigger and bigger. So I think best decision is to take her into hospital today. We'll give her a general anesthetic, have a really good look in there and just try and get rid of the problem and the infection.
It's always a bit hard with your fur children. They're like family, so I'll work through it because I know she's in exactly the place where she needs to be to get better.
She's gonna be okay.
Yes, my little kitty.
Hi, Yona.
Hi.
We've got Misha.
Come on in. Hi, Misha.
Audrey's about to start Misha's dental surgery with vet nurse Iona assisting.
Right, so we're going to take some bloods and pop her onto fluids, and then after that we'll get her ready for her dental procedure.
Sounds good.
I want to check her kidney function, liver function, make sure that that's all good to take the anaesthetic today. She's an older girl, so we need to watch out for those things. All right, the bloods are out.
The bloods are up.
Great. Okay. Well, it's not unexpected. So these 3 kidney enzymes are all elevated above normal. And not surprising that the globulins are also high because she's got a nasty infection in her mouth. Yeah. There's obviously an urgency to get this procedure done. She can't stay there with an infection growing in her jaw and in her cheek. It's actually burst. You can see some pus coming out from the inside of her mouth, just dribbling down her lip there. But I am a little bit worried. She has got a pre-existing kidney issue, which isn't uncommon in an older cat. So we do need to be careful with the general anaesthetic.
Hello.
Hi Priscilla, it's Audrey from Bondi Vet. It's all good. She's having a little bit of a cuddle with me and Iona at the moment. The reason why I'm calling is that we've run the bloods and it's not unexpected. 3 of her kidney enzymes are elevated.
Yes.
So moving forward, we still need to go ahead with the procedure, but we'll do everything we can to make sure that her kidneys function well during the anaesthetic.
Thank you so much.
Okay, talk to you
Thank
soon.
you.
All right, bye.
All right, bye.
So now I've got the cannula in, I'm gonna pop her onto the fluids and that will just keep her well hydrated before we start any of her general anaesthetic. So Misha's a bit of a tricky case because obviously being an older cat and having kidney issues, you're not keen to put her on the anaesthetic and put her through that. But unfortunately, she's got a condition that's life-threatening. If we leave it, we've really got to go in and get that infection out. Otherwise, she could die from that. So we're gonna go really slowly with her anaesthetic. I only wanna give her enough so that she just goes to sleep. We've just gotta be careful with those kidneys.
All right.
No, we found the vein, so I've just given it through the needle. What we're finding is the veins collapse with the catheter, so I'm just gonna give her some time to go to sleep. So what I'm doing there now is just giving her some gas. Like that is. Oh gosh, the abscess has just burst with that pressure. You might need a bigger bag as well later.
Misha's much-needed dental surgery can now get underway, with Audrey keen to keep the 9-year-old cat under anaesthetic for as short a time as possible.
So she's nice and anaesthetised now. She has the anaesthetic gas going through. So what I'm going to do is change this mask into a tube. Okay. And that will just deliver the gas straight to her lungs. All right. It's a bit hard to manoeuvre with a swollen cheek and a swollen mouth and a burst abscess in the mix, but so far so good. We're just connecting her up to the monitor now. That's going to let us know what her vitals are throughout the procedure. Close. 1, 2.
But suddenly,
Again.
there's a problem.
So we've got Misha anaesthetised, then she stops breathing. She's actually not taking any breaths on her own, which can sometimes happen, so I'm just breathing for her. Right. Okay. She's getting light. Come on, baby girl. Let's breathe on our own. Lucky for us, her heart is stable. We've just got to breathe for her. So Iona's there on the bag breathing for her while I just get on and do what I have to do. So here's the bad tooth. You can see the roots all infected. There's pus coming out the back of it as well. So we're going to have to take that tooth out. I think the reason why this abscess in the cheek is formed is because the root of that tooth has become infected, and that's because she's got bad teeth. So with dental disease, when the plaque builds up and the calculus builds up, it traps bacteria, and that feeds into the root of the tooth and the gum. What I'm doing is slowly pulling the gum off the roots, very, very gently. And I'm loosening the tooth from its attachments to the jawbone. I can see that some of those roots have dissolved away, probably because the infection is so bad. Okay, but it doesn't look like a normal tooth because all its roots have like rounded off. So these roots should be much longer than they are. So it's gonna be important moving forward from now, how we keep these teeth as clean as we can. All right, we're gonna suture up this big hole where I took the tooth out of. We've given it a really good flush with saline to get all that pus and infection out. Once we've done this, we're going to clean up all the rest of her teeth and wake her up and send her home. I'm really looking forward to taking Misha home to Priscilla. I know that she's waiting anxiously for her. I'm also really excited to tell her that we managed to get rid of the problem and how we're going to move forward to make sure that this doesn't happen again. Now, are we breathing on our own? Let's have a look. She's breathing now. We're all good. All right, chickadee, we're on the way home. Mommy's gonna be very happy to see you.
Misha has recovered from her dental surgery, and Audrey is returning her to owner Priscilla.
Look, there's Mummy. Hi, Mama, we're home.
Hi, Misha.
She's been such a good girl for us.
Hey,
baby girl.
She looks so good, much better.
Yeah, I'm gonna take her out so we can have a closer look.
Awesome. Welcome home, Misha.
Wanna come out to Mama? Come here.
I'm feeling so relieved right now that my Misha is home. Thankfully, she's so much better now, and I think within a few days she'll be back to her own little sweet self.
So everything went really well in hospital today. I'm really happy that we took that tooth out because there was so much pus and infection behind it, and that's why you had that bubble on the cheek bursting through. Also on the other side, I think that was also about to happen because there was quite a lot of pus in there as well. So we've given it a really good clean, a really good polish, and moving forward, I think the key is going to be keeping her teeth clean so she never gets another abscess again. Such a good girl for us in hospital today, weren't you, chicken?
She looks so much better.
Yeah, her face has gone back to normal, hasn't it?
Yes, she's got her
Feeling a
cheekbones
lot.
back now.
You got your cheekbones back.
Yay.
All right, so I've got you some Hills TD food, and I really like this food because it's going to keep her teeth clean moving forward. The great thing about these TD biscuits is because it's quite big, it actually will clean the teeth as she's crunching and chewing it, especially those back teeth, and stop that plaque and that bacteria buildup, which is the problem with her. Does that smell interesting?
Yum.
So she's still going to be a little bit sore from that surgery because we have removed a big tooth there and flushed out her abscess. So probably tonight, give it a go, integrate it slowly, and hopefully we keep those back teeth really nice and clean moving forward. All right, chickie. I'll see you in a couple of days. All right, bye, Priscilla. Bye.
Good girl.